Walshe of the Canberra Equine Hospital. Today we're going to discuss the appropriate management of geldings and stallions, sheaths and penises. So the reason that geldings and stallions need our help as far as cleaning and management of their sheath and penis is the anatomy. Basically they have a little cavity on the end of the penis that surrounds the urethral opening where the urine comes out. This little cavity collects dirt, debris, oil, skin and therefore needs to be cleaned out. The product that comes out often is called a bean, little circular shape, piece of tissue really, unattached but stuck in the cavity. So basically we need to help them out with that. So as far as actually how we get this process done, the cleaning process, the checking of the penis process, the watching, the monitoring, the observing, all those things are important because they do actually get not just dirty, but actually tumours on the penises, various other abnormalities that they can get on any skin surface. So the why and the how, I think, is because things need to be cleaned. It's very necessary. The when would be definitely every 6 months when they have their dental, when they're sedated, and therefore it's not dangerous to actually do the doing of the cleaning. So let's sedate this horse because it's a bit safer. Some horses will let you do it unsedated, some won't, but I don't mind at all at the 6 monthly dental that we just do it all together. So let's sedate him. Let's put a tail bandage on him so it doesn't flick in the face of his tail, which is also another hazard. And then let's clean. The actual cleaning product, I think warm water, soapy water, a little bit of betadine, those sort of really neutral products are the only things that are acceptable. So nothing with oil base, nothing that will be potentially irritant basically, and then a rinse off at the end with some plain water. So let's get to the doing. Tail being a problem. Grab a couple of gauze swabs, just a little betadine solution on them. Introduce yourself technically, tell the horse that you're going to do this little procedure, and then basically we're cleaning. So basically on the end of the actual penis, this is the urethra, the little pink surrounded area there, that's where the actual urine comes out. Then there's this cavity in front of where you can actually put your finger into, and that's where you'll get what they call the bean commonly. Little accumulation of debris, oil, skin. Little Sky has a little tiny one. But that's all that develops because I have been doing this horse every 6 months when I do his dental and keep him clean. So in 6 months that should be ideally all that actually adds up and gets collected. Tiny little piece, which then doesn't actually cause a problem to the horse. If you can imagine, in that cavity, where it really is only maybe 1 centimetre diameter, you can get actually a golf ball sized bean. Very uncomfortable for the horse, not great for horses' health, so that's why we regularly clean them. It needs to be removed all the time. Okay, so basically all the little pieces of skin and oil and debris are out. We're now rinsing, cleaning. We've looked at the penis, we've made sure there isn't actually any other tumours or abnormal looking tissue, and then we're happy with his health. Okay, so just really careful with the gentle pressure of water. We're just rinsing off the actual excess betadine, checking again that we haven't missed seeing anything. So as you can imagine, it's really important not to have any oil-based product in the actual sheath area because things will stick to anything that has oil on them. So I think the main thing is at the end of the whole procedure, you need to be sure that you've done the right thing by the horse and that there will be no reaction to what you've actually done. So nothing that you've put on there is going to then cause a problem later on. This reaction here on this horse, very sadly, was due to an irritant that someone had used trying to do the right thing to clean their horse. But as you can see, the ulceration that this has caused was quite extensive. So you do have to be really careful with the products that you use, and I think water, slight little bit of betadine, just as like a little detergent to help break up the oily skin, is absolutely all you need. So some things that can happen that aren't normal with the prepuce and the sheath area and the penis. is certainly swelling. Because of gravity, it quite commonly is the first place to swell. Maybe if it's the primary problem or in some other disease process. So, monitoring of what's normal is a good idea. Certainly in the hot summer months, because there's crevices, when the penis is retracted, you certainly can get flies, and then flies lay eggs, and then they can get maggots in there as well. So, there are other abnormalities that happen that warrant us continuing to look, in that area just on a regular basis, when you're grooming your horse every day. Other things could be, little wounds that you won't necessarily see unless you look. Until then, they get swollen, and then you sort of point it in that direction. Another thing to consider, especially with the horses that have pink pigment under their bellies and around that area, is that it can get sunburnt, like any skin surface can. And they certainly can, that could be a precursor to growing a tumour, but certainly your black skinned horses can as well. So preventative with these pink skinned horses, you certainly could stable them during the day, put them out overnight. As far as the sunburn prevention goes, you certainly could use zinc cream in that area. I guess the main thing is to remember that it is a skin surface. It is very, very sensitive to the sun, and when they're lying down during the day, it will certainly get sunburnt, and that definitely can lead to tumours on horses. And I think more often we do see them around the eyes of the pink-skinned horses as well, and people are looking at that more often than they are actually the underbelly of the horse. So just bear in mind, it's a good thing to look everywhere, every day on your horse, whatever the skin colour is, but that certainly is something else that can happen as well. So another thing to remember is looking at the actual urine passage, so the way the horse stands to actually urinate, the stream that actually comes out, what's normal for his colour. Colour is really important of the urine to help indicate us all sorts of things, hydration of the horse, maybe illness of the horse, certainly any trauma within the actual penis or the sheath or the bladder or the kidneys can be seen with red urine. They certainly can get bladder stones that we would never know anyway, except maybe, if you x-rayed or you put a camera up the penis. But what you might first see is a tiny bit of blood in the urine to help then indicate that there is a further problem that we need to look into. So the stream, the consistency, the colour, those sort of things, if you get to know what's normal for your horse, then you certainly see proactively what then becomes abnormal. And quite commonly, if they're a riding horse, they will urinate not long after you have actually ridden them. So maybe getting into the pattern, or therefore you get to see it. If it's a horse in the paddock that you don't actually ride, exercise, maybe you don't get to catch it and see when he actually urinates. But it would be good to try and find some way to stimulate him to urinate or to know when he does, so then you can see and then monitor. And it's all about looking after the whole horse, seeing everything you can, getting every bit of information you can to be proactive with the preventative medicine, and then that certainly would help us keep the horse healthier for a longer time. So thank you very much for watching and listening. So basically, to wrap up, the main points are proactive medicine. Get to know what's normal for your horse, for your gelding, for the sheath area, the penis area. Make sure you do see anything that changes: stream flow, colour, swelling, growth, cleanliness, the beam, remember, the cleaning out of that. So, and these things, realistically, if you get onto them early, will help prevent anything serious from progressing. So thank you very much for watching. Today's been brought to you by the Canberra Equine Hospital and the Equine Dental Vets.